Morton's neuroma. Pain on the bottom of the foot. Really hurts when you walk. When you squeeze the foot like this, it's really painful. What it is there's little nerves that grow in between the metatarsals, the bones of the foot, going into your toes, and they get a little growth on them. They get a little, almost like a tumor, for lack of a better word, but a growth. It's called a neuroma. And any time that the foot's compressed, it tweaks that nerve and it's painful. Real common problem, but it's also something that symptomatically responds extremely well to chiropractic and sports therapy, chiropractic sports therapy. We don't treat the neuroma in these cases. First of all, like everything else we talk about, always get an accurate diagnosis. Make sure that's what your problem is before you go ahead and start taking your treatment off of any video on the web, whether it's one of mine or somebody else's. But let's just say you've been diagnosed with Morton's neuroma. So from a chiropractic perspective, what I want to think about is the alignment of the metatarsal heads and their function, their mobility, which are these muscles, these bones in the foot. They go from the midfoot to your toes. There's 5 of them. And we check to make sure they move normally. And they flex up and they flex down and through here where the metatarsals meet the toes, and then where the metatarsals meet the midfoot, and then where the midfoot meets the ankle. I check for movement of all those individual bones. Because if those bones aren't moving properly, then the muscles are going to have to work harder, and it's going to create compression, and it's going to irritate that neuroma. If there's joint locking or loss of motion in any of those joints, well, we treat them with a chiropractic adjustment. And sometimes you get those little clicks. That would be the chiropractic adjustments for the metatarsal heads. Then we do shearing adjustments to get that to open up. And then we can do an A to P glide for the midfoot. And sometimes we use an adjusting block to get to that midfoot as well. Bend this knee for me, please, Amanda. Where we can grasp one row of ankle bones and then the other row, in the foot rather, one row of foot bones. We have the cuneiforms. Here's the navicular. And then impulse on it. And it should give us a little motion. And that gets it to create some motion over there. Okay? So, adjust the foot is first. On top of that, we do some soft tissue work. I like you to grasp in because that loosens the muscles. And I'm going to do a little bit of grasping with some BioFreeze lotion because Amanda's having pain. So I'll do some BioFreeze lotion to do that. And I get right in between the tendons and the metatarsals. And we'll do this on the top of the foot, following it all the way down. And then we'll do it on the bottom of the foot as well, in between. Just relax the foot. There we go. So I can break down any tightness in the soft tissues. The Morton's neuroma is still there, but if there's less compression on it from the soft tissue, if there's less pressure on it because the joints of the ankle or foot are moving better and the tissues don't have to work so hard, guess what? It doesn't give you pain. On top of that, a lot of times we'll talk about an orthotic with a metatarsal pad that goes here, which causes the foot to arch up at the distal longitudinal arch, and that also takes the pressure off the area. So we get the pain out of the way. The Morton's neuroma is still there, but guess what? It works, it's effective, and it's a lot safer than invasive surgery. I'm Dr. DeFabio. It's been a great day to talk about Morton's neuroma. Thanks for tuning in and subscribing.